Well, apology for that staying too long on the instrument. Good morning and thank you very much for joining us this morning. It is Monday, the first Monday in the month of April 2020. And of course, it is the first edition of the program right for this week on Flow 94.9 FM. This is the Flow of God's Own State. And it is the platform, the pinnacle of all discussions right here. It comes on radio every Monday, every Wednesday, and also every Friday on Flow 94.9 FM, the Flow of God's Own State. Well, it's no longer news that Nigeria is battling with the pandemic also that is ravaging the world, talking about coronavirus, COVID-19. Well, we will be bringing you up to speed on what is happening in the world. And of course, our conversation this morning will center on COVID-19. And we have doctors in the studio. We will be talking about what the doctors are up to as far as curtailing this virus is concerned in Nigeria. It is Flow 94.9 FM. My name is Michael Oni. Well, this morning, presently, as at 8:30 a.m., today is 6th of April 2020, there are 1,276,117 coronavirus cases with 69,509 deaths, and the number of recovered patients 265,943. Meanwhile, France and Italy recorded their lowest death toll from the coronavirus in 1 and 2 weeks respectively. France recorded 357 deaths, lowest daily increase in a week. Italy reported 525 deaths. Well, in Nigeria, a total of 8 new cases of coronavirus COVID-19 were recorded in the country as at 9:30 p.m. yesterday. That was confirmed by the Nigeria Center for Disease Control. These bring the total number of confirmed cases in the country to 232. Well, this morning I do have members of the Nigeria Medical Association here in Abia State with me in the studio. Dr. Stanley Ogochukwu Okerulu. I hope I'm correct with your name, Dr. Stanley.
Yeah.
Good to have you join us this morning,
Join
me this morning on the conversation. And also, Dr. Ngozi Nwankwo is very much here with us this morning. Good morning to you, Doctor.
Good morning, Nigeria.
All right, good to have you join us this morning. Well, as medical doctors, it's good you refresh our minds to what this virus is about. Dr. Stanley.
Yeah. It's not a news again. Coronavirus has been ravaging our nation and, of course, the whole world. It's good to understand what coronavirus is, so that one of the challenges we are passing through currently is that a lot of false information have been disseminated to the public, and a lot of news going here and there. So I think it's a privilege this morning for people, the masses, to hear from doctors and particularly from representatives from of Nigerian Medical Association, Omaha chapter, about this disease. So coronavirus is a disease that has been in existence. I think the first cases were recorded in the 1960s. And however, the epidemic, which transcended to become a pandemic we are having right now, was started somewhere in December last year, 2019. In a place called Wuhan in China.
Okay.
It's a different strain from the earlier known coronavirus, which has had some epidemics in the past. Now, we all know there are microorganisms that the eyes cannot see. We have bacteria, we have fungi, we have viruses, and so many others. Now, viruses are the smallest type of these microorganisms.
Okay.
Yeah, and coronavirus is one type of it. Is an RNA virus, and what it does is when it gets into the system, it causes disease, which is what we call the coronavirus disease, and brings a lot of symptoms. Makes everybody or anybody who has it feel ill or feel sick. So basically, as it started in Wuhan, it spread, became an epidemic, and now it's almost ravaging every country, almost over 100 countries in the world. And in Nigeria, as you said this morning, it's over 232 cases. So coronavirus is a disease that presents with certain symptoms of fever, headache, cough.
Okay.
And
But
sneezing.
before we
Yeah.
get to the symptoms,
Yes.
Dr. Stanley, I would like to take Dr. Ngozi.
Okay.
You mentioned, Dr. Stanley mentioned transmission, that there is a way it moves from one person to another. I would like to take you on the mode of transmission, how it transmits from one person to another.
Okay, thank you very much. Coronavirus disease, as we have it today, the COVID-19, it moves from person to person majorly through what we call droplets.
Droplets.
Yeah, these droplets are things that come out when people cough
Okay.
or sneeze, or even when they are talking. You know, sometimes something comes out from people's mouths that is liquid when they are talking. That's what we call droplets.
Okay.
So it can move, and as it's moving from one person that has coronavirus to another person, it may carry the viruses. And if the next person is very close to the person sneezing or coughing, he can pick it up by inhaling it, breathing it in through the nose or into the mouth, and then it settles there and starts causing problems. In addition, it can also spread through what we call contaminated surfaces.
Okay.
That's indirectly, really. If somebody coughs or sneezes on a surface and the viruses are stuck there, someone later could just come in there and touch that place, maybe touch the nose, and it also
So
goes
you're
in.
saying door handles were not safe from door handles, your tables and the likes?
Not at all. We are not
Interesting.
safe once people have coronavirus disease around.
So,
Also, it's important to note that there's something we call aerosols.
okay.
For instance, in hospital settings, when we are giving people oxygen, or we are taking over, put a tube into the nose to help that person breathe better, we can, because of the force of the oxygen going in and coming out, we can generate what we call aerosols. So they are tiny particles, not as big as what comes out in droplets, and it can circulate in the air because it's using some kind of wind force.
So can we say it is airborne?
Right now, the WHO is saying no about
Okay.
airborne, but for aerosol generating procedures, things that can force air in or out of a
Okay.
person, you can actually generate aerosols that can be transmitted. And it's important to also remember that man to animal, animal to man transmission is also possible.
Okay, interesting. Well, I would like to take you on the symptoms, Dr. Stanley. Now, we know it can, spread from one person to another. I would like to take you on the symptoms.
Okay.
What are the symptoms of coronavirus, COVID-19?
Okay. Coronavirus causes a lot of problem in the body. The commonest symptoms for coronavirus are fever, very essential. Fever. Yes, the person should have fever. Cough.
Okay.
Is also one of the symptoms, and some other symptoms includes even sore throat, sneezing, sore throat.
Sore
when you
throat.
start feeling sore throat, they are not very common, but they
Okay.
also do exist. Sore throat, sneezing, difficulty in breathing. When you find it difficult to breathe, you understand. So those are some of the symptoms. Even you can get to an extent of even giving you headache. Sometimes you may even have diarrhea, but they are less common symptoms. But the far commonest symptoms that we are looking out for: fever, the cough, sneezing, and of course the sore throat, if there's any.
Okay,
Yeah.
interesting. Dr. Ngozi, you mentioned aerosols, you mentioned some droplets, if I'm correct. Aerosols, droplets. So one will be asking, we have so many face masks now, with different versions. We have the ABBA version, the one that is coming with the cloth. We have the one with the popular one, the surgical mask, I believe that's what you call it. So how really effective are these face masks that we're using to prevent ourselves from, inhaling the aerosols and some other of these materials, some other, terminologies you've used this morning on the program?
Okay, thank you very much. Actually, as concerns mask, there are guidelines for usage.
Okay.
For very small particles, we would expect that people would use what we call respirators. They are very high masks, not the ABBA one, not the surgical masks. However, those other masks, like the cloth mask, the surgical mask, They are used to prevent people that already have the virus from letting out the droplets.
Interesting.
So it's actually covering the person that has the virus from releasing it, not necessarily covering the uninfected person from picking it up.
Okay.
So the idea of those other masks is everybody keep your own droplets to yourself. Basically, that's what they should do. And they're not 100% effective.
They are not 100% effective.
Yes,
And then the common one.
Yes.
Which one is 100% effective?
Well, the respirators, like the ones we call N95, N99, N100, the numbers are according to how much they can filter out the air of particles.
But they are not very common. The ones you mentioned,
Of
the
course they are
N95, N70, and the like.
Yeah, they are not common and they're expensive and they may not even be available right now. So for the WHO, the World Health Organization, they advise that just people that have symptoms, the fever, cough, or any other thing, respiratory sneezing, should wear masks so that their droplets don't go out into the air. While health workers or home care people that are caring for those that have the virus should also wear masks to protect themselves, but it's not that effective.
Interesting.
So that's what the WHO has said, even though some other countries and people are saying everybody wear masks. The whole idea is everybody keep your own droplets to yourself. Not necessarily that mask is going to prevent you from picking up
coronavirus.
It's more of keep your own to yourself.
I will take you later on what can be done to keep you off from coronavirus, since the masks are not even that effective.
Exactly.
But it all started in China, and today the country is reporting low infections, which has reignited the speculation about the virus being a biological warfare amongst world powers. What is your take in all this?
You see, people will go ahead to disseminate information. Like I said, there are a lot of false news, a lot of false information, and it being a war. Our focus should not really be on whether it's a war or not a war.
Okay.
It's already causing issues. It's already causing problems. So we should focus on preventing this problem. Later we can talk about
some of the controversies outside. The one that came over the weekend is the 5G, the connection between the 5G network and coronavirus case.
Yeah. Of course, these are just propaganda, I think.
Propaganda?
Yeah, there's no medically proven connection between 5G network and coronavirus ravage. In fact, today I put it up on my status. People are calling me, asking me, what's the connection? There is none recorded so far between 5G and coronavirus. In fact, there are agencies which regulate radiations, and of course they are the ones taking care of the networks and the 5G. But for coronavirus, this is a disease that is already affecting, transmitting from one person to another, not from the internet, not from the waves, but from one person to another. So we should focus more on preventing it than talking about things that are not necessary.
Interesting. You want to say something about that?
Yes. You know, when the cell phone came in newly, there were these fears that they cause cancers of the head and the brain. And studies, very large cohort studies have been done in more developed countries where over 100,000 people were followed up over time, and nothing was found that was different for those that used phones and those that did not. So it's likely it's just about the same thing with 5G network. And most countries in Africa have not launched 5G. And we are detecting coronavirus, so it's really difficult to tie that up. It's just like 3G, 4G, 5G, and G is for generation. So it's unlikely, but then we are watching. Without 5G, we are getting the virus. So let's, as Dr. Stanley already said, let's focus more on how to stop ourselves from getting these things.
Interesting. It is still the platform right here on Flow 94.9 FM, Monday edition, 6th of April 2020. Well, I'm surrounded by doctors, members of the Nigeria Medical Association, Umuahia branch, and of course Dr. Stanley Ugochukwu is very much with me, and also Dr. Ngozi Nwankwo. We're talking about coronavirus, COVID-19, presently ravaging the world. About more than 232 cases confirmed in Nigeria already. Now, I would like to take you on, you spoke about the symptoms, and you mentioned something that those with the symptoms can transfer this virus to another person,
yeah.
to someone. What about those that are asymptomatic, those that are not showing signs of the symptoms of COVID-19?
Yeah, this is a very important question because it's known that transmission, as in the virus going from someone that has a disease to another person, is highest when there's a symptom. Because that's when people are coughing, they are sneezing, they are producing the droplets we are talking about. However, people that have not started having symptoms can also transmit.
But they are positive. So it's possible to be positive and yet not showing symptoms.
Exactly. Just like many other diseases, it's possible to be positive, to have the virus, and the symptoms have not started showing or will never show. Because some people have very mild sickness, that feeling, hi, I feel a little unwell, and then it goes away.
Probably they have strong immunity.
It's possible, or for some other reasons, they are just not showing it.
Interesting.
Yeah.
Well, so it's important to stay safe. You have the symptoms or you do not have the symptoms.
Exactly.
It's very important to stay safe.
Exactly.
Well, interesting. So how do you diagnose coronavirus as a doctor, Dr. Stanley?
Once coronavirus is suspected in someone or who has history of, especially those that are coming in from abroad, especially from countries where this coronavirus already have confirmed cases, or somebody coming in from another state where it's already confirmed, they are high risk people we suspect.
More like their travel history.
Yeah, travel history.
Okay.
Then of course those, just like we say, some people don't really present symptoms. So those already presenting symptoms of fever, cough, difficulty in breathing, or breathlessness of any kind, they are high suspicious patients. So we take their samples for diagnosis. There are protocols we follow. And we report to NCDC, of course, starting from the state Center for Disease Control, how then they would come to you where you are and take your samples for the test. Of course, counseling you on social distancing, isolation, and the rest, so that you could stop spreading the virus. And we usually take respiratory samples and serum, the blood samples, for us to make diagnosis for this. But all those will be done in the lab. I don't think it's something we should go into deeply.
All right.
Yes, so
All
those
right.
are how we confirm.
It is still the platform right here on Flow 94.9 FM. We'll go for a break now. When we return, I will open the phone lines. I know you have questions, but I do have some other questions to ask the doctors here. I want you to evaluate Nigerians' approach in Nigerians and also Nigeria as the government, the approach in containing this virus, and also, of course, what you think about the measures put in place by the government. If it is enough, if it is not enough, we talk about the lockdown in some of the cities when we return after the break, and also I will entertain your calls. It is the platform right here on Flow 94.9 FM.
At Flow 94.9 FM, we've got conducive and well-secured environment for business. High-tech video studio, a state-of-the-art production studio. You can also listen live on www.flow949fm.com and watch our videos on YouTube at Flow FM TV. Flow 94.9 FM, not just radio, but a complete broadcasting house.
Well, it is still the platform right here on Flow 94.9 FM, the Flow of God's Own State, a Monday edition. And of course, it's still about COVID-19 as far as we are concerned here. And of course, we are praying that we will curtail and come over this virus, not the virus coming over us. Well, this morning, I still have with me doctors from the Nigeria Medical Association, Umuahia branch, Dr. Stanley Ugochukwu, and also Dr. Ngozi Nwankwo. Now, if you want to be part of the program, it's 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289. I know you have questions, and the doctors are very much here to take your questions. And of course, for those of you that are still believing that there is nothing like coronavirus, you've heard from the doctors this morning, so it's better you you take responsibility and, of course, stay safe. Very, very important. Now, what is your evaluation of Nigeria's approach in containing this virus? We've seen some of the measures put in place by the government, lockdown in some cities. In Abia State here, today is day 6 of the lockdown, subject to review by the government after day 7. So what is your evaluation of the lockdown?
Okay, the Nigerian government, I would say, has actually done much more than I expected. Yeah, it's impressive how our CDC swung into action. It's unprecedented to take over and head the response of Nigeria to the coronavirus disease. I wouldn't say we are 100% optimal.
Okay.
But we have done well, and more interestingly, we keep improving.
Some persons are saying the lockdown is to punish the citizens.
Well, I wouldn't blame anybody for feeling that way, because our economic situation is worrisome, as a lot of people have to go out every day to make some earnings for their normal daily life. So it's difficult. It's a difficult time, I must say. But it's better we do what we have to do early enough.
Okay, we have someone on the line. Sorry, doctor. Hello, good morning to you.
Good morning, Michael.
You're welcome. Good morning.
Good morning, my medical practitioners in the studio.
Good morning.
Good morning.
Thank you
Good
for
morning
coming.
to you. Thank you for calling
I'm sorry to have caught my good doctor. Please don't be annoyed, my doctor.
No, it's good.
It's okay.
We are here for you, please.
What's your name?
All right, before I start, my name is Mr. Swago Friendswell from here in Omonachogo.
You're welcome.
My doctors, please, I would like you to expatiate more on the relationship, on the non-relationship, as you said, between this COVID-19 and 5G network. Please expatiate more. Then secondly, who is to wear the mask? Is it the carrier or the recipient? That's my team. God bless all of us.
All right. Thank you very much, Mr. Princewell. Okay, let's see if we can entertain more calls. Hello, good morning to you.
Good morning, Michael.
You're welcome.
Good morning, medical practitioner in the house.
Yeah,
Good
good morning.
morning.
God bless you.
Who's Nodi, calling from Mumbai.
You're welcome.
Medical practitioners, I have a question to ask for contributing. You know, like in Spain, China, and Italy, we had, I've seen serial problems of coronavirus, how it kills. You know, most times it doesn't even stay up to 1-2 hours, the person is gone. But in Nigeria, that's why most of us are still doubting whether the ones that are in Nigeria are China-made coronavirus or the real one that is happening in Italy, China, and America and other countries, developed European countries. Because in Nigeria, we've having number of persons, we've been having discharging ones. Does it mean that Nigeria has found cure to this problem? Or if possible, then we should take our medical doctors to those countries that are suffering, instead of importing people from China to come and assist us here in Nigeria.
All right.
Why we are still recovering from the
Very,
number
very
of
nice question you've asked this morning. And, well, doctors.
Okay. Thank you for your question. I think we'll start from the last one. 1 to 2 hours it was quite funny to us.
Exactly.
And, who dies 1 to 2 hours? Of course, there may be 1 or 2 cases or few cases that may die within that period. Maybe they already have underlying conditions that are very serious already.
I want you to break it down what you mean by underlying illnesses. It means the person has something.
Yes, like the first person that died in Nigeria for coronavirus, he had some other sicknesses that was already ongoing, which made him go for treatment, for checkup, and of course when he eventually got the coronavirus he couldn't, and of course by then his immune system was very down already, and he didn't survive it. So one of the reasons why people die is because of the fact that either they are elderly, and elderly age, when somebody is aged and is elderly, has some form of reduced immunity compared. Then sick patients, people that are already sick with any form of disease
Down
already
with
that,
any
yes,
ailment
especially
already
chronic
done.
diseases that would bring down the immunity, yes, could also make the person at risk of dying from coronavirus. So the person,
in addition, for Nigeria, we've had 5 deaths
Yes.
and about 230 cases. That keeps our death rate at 2%,
Yes.
which is comparable with between 2 and 5 that other countries are having. So people are actually dying here. Among those that we have confirmed have the disease, 5 is a lot.
Yeah.
So it's still 2%, and that's much. So it's not as if people are not dying here.
It's not.
And really, we wish we have a cure so that we'll be the ones exporting doctors.
The truth is that even the cases we have that have recovered over some treatment, our Nigerian CDC has told us that it takes about 1 month to get them cured before they are released. Now, our first case was just recorded, I think, last month or so. The first case we had.
The first case in Nigeria. Because we are in Abia. Not to confuse people.
Okay, yes. The first
we
case
do not
in
have
Nigeria.
any case in Abia State.
Yes. No, we don't have any case in Abia State. The first case in Nigeria was just recorded last month. So those other countries have had their first cases before, and it has started spreading. And of course, if you check the last few days, we had less than 200 cases, and by today it's already 232. So probably tomorrow we'll have more cases. I think what we should, we don't pray for that, but what we should do is to focus on preventing this this coronavirus.
I would like to take you on precautionary measures later on the program, but you spoke about droplets on surfaces, handles, your railings, your tables, and the likes. One of the reasons I believe those surfaces should be disinfected regularly. But how long does coronavirus stay on surfaces outside the body?
Okay, well, the information so far is that they could stay up to days.
Days?
Interesting. Some surfaces up to 7, 8, 9 days.
Wow.
So we should assume that they are still there and just wipe our surfaces with either bleach or sanitizers.
Oh, interesting. All right, let's
say the surface that had the lowest duration is about 4 hours, and that's copper. And some copper within 4 hours. It's
4 hours.
Yes, but we have surfaces where it can last up to 8 days. So I think we should take caution and clean surfaces that people touch easily. The rails, like you said, the door
light switches,
handles,
very important.
Light switches.
People always forget that.
For those that are using lifter, the buttons, all those buttons people press frequently. We should try to clean them.
Hello, good morning to you. Hello.
Good morning, Mike.
Good morning to you.
Yeah, good morning.
This is from City guy for you. I'm calling from the
All right. Well
done.
done.
To the son of this person this morning. I think I'm looking on the side of Batongaji. I think if you have still more light on the side of this our face mask and face mask. Because I think the way people are going about it, I don't know exactly what it's all about. I think when the Batongaji was saying something, the mention of the one that's positive and the one that's not. In the sense that these are face masks, the way we are putting it, is not preventing for anyone not to contaminate the disease, rather preventing the droplets that come out from the person putting on the face mask or the nose mask. So that's another aspect of it. It's very, very important that now it has enlightened people to know that this is not a way of not contaminating the disease, rather preventing one or making stopping one not to the droplet that may come out from the one's mouth not to go out to transmit to another person. That's very, very important. Then,
all right, quickly wrap up your thoughts so that we can allow others.
On this sanitizer. This sanitizer, they say that if you are ready, I want to ask this question to the doctor in the house. This is the sanitizer. Then when you rub it as anyone now rubbing the sanitizer, is you not going to be aware of washing the hand of that person, like cleaning the hand of that person? Because if you're aware of making that person, if that person touches the droplet that may come out from any person, is there a way of preventing it? For just for that person to make sure that they use your hand, they wash, this thing all the time.
All right.
Then lastly, That's your
Well,
fault.
I won't allow you
We'll
take
take-
that
we'll
so that
take
we
this
can
to-
allow others. We take the two questions.
You talked about face masks, like my colleague Dr. Ngozi rightly said. We have challenges with the way people use these face masks. They don't adhere to the procedures of
Okay.
using it, touching it. And the challenge with face masks is that by the time you wear it, some people are not cautious enough not to touch it, but they keep touching it, adjusting it. And one of the challenges of the transmission of coronavirus is when you touch your face, your eyes, your mouth, your nose, it spreads faster. You get it faster. So we encourage people to avoid touching their faces, touching their eyes, touching their nose as much as they can. So wearing face masks will make you to keep touching, keep adjusting, except for those doing it for professional reasons. And the only benefit we really have with face masks for public is just to make them keep their own aerosols, so that they will not transmit to another person.
Okay.
But apart from it, it's easier to get it because you keep touching your face, adjusting it. So there are procedures. You remove your face mask from the band.
Okay.
That's the one on the ear, not touching it on the front because you already get it. So I think if we must encourage people to wear it, please, they should learn how to use it because it will help you to keep their own aerosols. Then of
I
course,
think I should link that with the precautionary measures now.
Yeah.
Sanitizers and hand washing. Some persons will say wash your hands with soap and water, and after washing you still use sanitizers, 70% alcohol based sanitizers. So I want you to break it down. How
Yeah.
do we go about keeping our hands safe?
Okay, the thing is washing your hands. If you have water and soap, please use water and soap to wash your hands. If you don't have water and soap, you can use sanitizer, but not using the two at the same time.
Okay.
What this one does is what the other does.
Exactly.
So when you wash your hands with soap and water, at least for minimum of 20 seconds, you're washing and making sure you wash your hands following the recommended ways of washing
a
your hands.
minimum of 20 seconds.
Minimum of 20
Okay.
seconds is what WHO recommends. Minimum of 20 seconds. Then hand sanitizers, if you don't have water and soap to wash your hands, you can now use hand sanitizers as options for carrying around, for those that want to carry it in their pockets for moving around, so that they can encourage doing so, but not using the two at the same time. I don't think there's any benefit. Now, doctor, what do you think?
It's like wasting resources basically. So one is enough. The soap does the same thing that the alcohol does. This virus is covered with a kind of fat layer. The way soap breaks down the oil on your plate, that's the way it would break down the oil covering the virus. So the virus just disintegrates. That's the same thing alcohol does. So there's really no point using
That's
the two.
because it is an RNA virus.
It's an enveloped.
Enveloped
Exactly,
virus.
the envelope.
All right.
Yep.
Because
Okay.
the microorganism.
Okay.
Any microorganism would be killed using
Okay.
the alcohol, bacteria, virus. So we're not just, you see the concept. Now, the benefit of this hand washing does not only stop coronavirus.
Exactly.
Every other, now we may even be having less cases of diseases,
Diarrheas,
gastroenteritis,
exactly.
diarrheas, vomiting, because of this attitude of washing
Okay.
hands.
Let's come back to some of the current issues now.
Yeah,
Nigeria planned to bring in expatriates from China to help in containing the virus. A good move or not?
Well, the Nigerian Medical Association's stand is that it's not such a wonderful move.
Okay.
Because the NMA, National NMA, has advised the government to improve on what we have on ground instead of bringing in more things. We have a lot of people, doctors, residents in training, consultants that are experts in infectious diseases.
So how prepared and motivated are the health workers to fight this scourge?
So far, health workers are really motivated too. There are a number of things people have asked for. For instance, personal protective equipment, these hand sanitizers, cleaning surfaces, basic things that would ensure infection control. That's basically what health workers want done. And so far, we've not had help from anybody, and the cases are being managed. Those that are symptomatic, the suspects are being visited and samples collected from them. So I, just like NMA, I wouldn't know the extra benefits of bringing in some experts from elsewhere. But then, if the government believes strongly that it would help, well, but NMA has advised really that there's no point at this time bringing in those.
Good morning to you.
Good morning, Mr. Michael.
Good morning. Please move away from your radio set.
Okay, no problem. Let me do it.
Thank
Let me
you.
know why it.
Thank you very much.
Now,
Your name,
I know
please.
it's okay now.
Yes, it's better. Your name.
Okay. My name is Mr. Mado.
Okay.
Editor-in-Chief / Iron Pillar. This morning I call for the Newport looking for that.
All right. You're welcome.
Good morning, the gentle body code leaders.
Good morning to you. Please, let's go straight.
I thank you people for the way you analyze the whole thing this morning. And we believe that in the Southeast, there will be no story about that. That's part, however, it may spread. Because if you can see up to this time, since 9th of March, December, today started from it now. We haven't got this story. We cannot get it again. But my question is this. The ones that, the carriers that died, I don't know how they take to bury them. Whether when they died, did the sickness also die with them at the same time? Then, another area that I'm asking, because you think you cannot touch your eyes, your nose, and your mouth. And you see eventually you cannot touch electricity, switch, or even television or fan. So everybody can say that you lasted there so long. Now I want to know, if at all you go through this airline or this lifter, and maybe you come out, wash your hands, and you either use a sanitizer, would the thing affect your life? Or is there, maybe you wear a long sleeve shirt, and maybe somebody's body touches when you wear long sleeve shirt. Does he have a way to penetrate even with the clothes?
Okay.
Or does he have a way?
All right. I think we get your question now.
Okay. We've recommended. We've told you what you need to do. Avoid touching your face, your eyes, your nose, your mouth with unwashed hands. Practice washing your hands regularly, whether you wear long clothes,
long sleeve,
or short sleeve or whatever. What you should do is to avoid touching your face, your nose, your eyes, your mouth with unwashed hands. Make sure you wash your hands frequently, and you run away from this transmission.
Okay, on the SMS line, Agu Tochuku from Ubakala says, now I want to ask first of all, good morning, Mike and our guest. Please, is it advised to change the mask from time to time, or how long should one use a particular mask? That's coming from Agu. All right, doctor.
Okay, let me make a statement about the long sleeve thing. The shirt is also a surface, and the virus could be there. And because it's a cloth, if there's wetness, it can get wet through the cloth onto your skin. It doesn't mean the virus will enter, but if you touch that part of your skin that is contaminated and touch your nose, it's possible to get the virus. So it's advised that when you have had contact with people or surfaces and you get back home, please wash your hands, wash those clothes, and then have a bath. That's your best bet to get rid of all the viruses that may have come onto your body in the course of associating with people. As for the SMS,
yes,
face masks.
Yes.
You see, these face masks are supposed to be disposable.
Okay.
And not to be reused. And that's why we are recommending the masses to leave the health workers and patients or patients' relatives that are helping, or caregivers as it were, helping to use the surgical face masks, N95 masks for strictly for health workers. So as we will not be having lack of these things, these equipment or these face masks in the hospitals. Now if you must use it, then it's recommended that you avoid touching it, because that would spoil it faster, or that will contaminate it faster. Then possibly after one use, you don't reuse. there are people proposing homemade face masks and how you could wash and reuse them. The benefit for those one is for you to keep your aerosols yourself. Yes, so that's what we can say.
Interesting.
Yeah, and really they shouldn't be worn all day long. A few hours, 4 to 8. And then if they get wet, for instance, you're walking, you're sweating. Once they get wet, they don't offer anything at all. So you should just change.
Okay. Good morning to you.
Hello, good morning.
Morning to you.
Doctor, good morning.
Yeah, good morning. Go ahead.
My name is Israel, calling from Omaya here in Bende Road.
Welcome, Israel.
Yeah, please, there's something I want to ask. I have 3 questions to ask.
You have the opportunity to ask only 2.
Okay.
All right.
Now, number 1, if a person that contracts that virus, being coronavirus, after healing the person will now go back to his house, the person need to associate with the entire family, or do we need to keep the person a place like a month in case of if the virus will not reappear?
Okay.
But
The second question
television
now.
where Trump was addressing people.
No, just go to the second question.
now.
We
The second
understand
question.
the first one already.
The second question. Your second question now, please.
Okay, that's number 1 question. Number 1 question is this: if the patient
Go straight to the
has
second
already
question.
tested
Second
positive-
question. We heard you. Your second question, please.
Okay, the second question: did the person need to come back for checkup like 2 or 3 months?
Okay.
Okay, thank you very much. What we want to say about somebody treated, before NCDC would discharge you, you would have fulfilled certain requirements, certain criteria that makes you fit to interact with people. However, we still want, there is need for social distancing. So even if you're discharged, whether you're discharged or not, keep social distances, 6 feet distance between you and the next person, 6 feet at least. So the question shouldn't be whether the person should mingle back. When the person goes back, he's usually counseled to avoid contact with people, because he can be reinfected again if he doesn't take care. So but as it is, if he's discharged, that means he's tested negative for the virus
Twice,
yes,
not just once. You have
twice.
to test 2 times,
Yes.
and it's negative twice. So
Symptoms
that
are no
doubly
more
sure.
there again. Yes. So
And there is no need for any checkup really,
Okay.
because he has already tested negative twice, unless he gets infected again. So he should continue to maintain social distance like every other person. And remember hand hygiene, and not touching the face.
Yeah,
Okay.
then of course.
Doctor.
We're talking about China. One of the challenges we're having bringing Chinese into the country is, you see, that area was the origin of all this. So we're not certain what the people are coming in are safe. They may be also infected and coming in and now comes in to present with symptoms. Most people we diagnose are people that came in from outside the country, regardless of whether they are health workers. In fact, health workers are high risk people. So when they are coming in, they may already have it, and it's now when they come, they start testing positive.
When they come in, we'll quarantine them for 14 days before they start whatever they are coming for.
Yeah. So that, our enemy stand still remains. I think we should utilize what we have. We're already making progress.
What we have brings the question, the readiness of our health system. That's a big question. Are you satisfied with what you're working with?
Well, our health system, just like many other health systems, were not originally designed to have every day of this kind of challenge that the coronavirus disease is presenting. Right now, Nigeria is making good use of what we have already. And private organizations are also doing some things in a bid to join hands with the government to address the challenges so far. But there's always room for improvement. Even countries that have been known to have very good health systems are being overwhelmed. Let's keep improving. Every day, let's put one step in front of the other. To have PPEs, to have sanitizers, to have standard isolation centers. We
All
can
right.
convert, we can build new things, we can do makeshifts, just like Lagos has done. There's a
Okay.
lot that we should
All
just
right.
keep improving. That's
Dr.
it.
Ngozi, I know if I allow you, we can continue from now until tomorrow. Thank you
Yeah,
very
yeah.
much. Dr. Stanley
Thank you very
Ugochukwu, thank
much.
you very much. And Dr. Ngozi
Thank you.
Wanko, thank you very much. Members of the
Nigeria
Nigeria
Medical
Medical
Association.
Association.
Yeah, there's
Umuahia
something
branch.
somebody had asked, if I may just say a word about it,
Okay.
about burial. Usually when somebody dies from a highly infectious disease, the person is buried by the state in a certain protocol.
Okay.
For coronavirus, when someone dies, he's no longer breathing, so he's not bringing out air. So we don't expect that he's that infectious, but his surfaces, he may have already coughed or something on his body, but generally he's not such high risk. Like he's not breathing anymore. He's not bringing out air.
Okay.
So
all right.
it's low,
Our
but
time
the
is
state
fast
fell.
spent. We hope to have you some other time to talk much more on coronavirus, COVID-19. And it's very important that you stay safe. The doctors are also going to stay safe for you and keep working for you. They're staying at work for your sake, so stay safe.
And stay
Doctor-
home.
Yes.
Stay
Thank
home,
you.
stay
Stay
safe.
home, please.
Dr. Stanley
Yeah.
Ugochukwu and Dr. Ngozi Wanko, thank you very much.
Thank you.
The edition of this program will be on our on our YouTube page later on today on Flow FM TV. Many thanks to the producer Samson Eze. My name is Michael Oni. Do enjoy the rest of your day.